Hello, and welcome to Community Conversations for Wednesday, November the 18th of 2020. Community Conversations is a joint effort of English Lutheran Church and the La Crosse Interfaith Leaders Coalition. And I'm Pastor Park Hunter from Onalaska United Methodist Church. I'll be the moderator today. Community conversations are intended to engage citizens in thoughtful and theological, nonpartisan and non-political discussion about local economic and social issues. And we try to choose topics that we know will be particularly relevant to our local area. We actually just announced the topics for the winter and spring season that is coming up. And just to let you know that on the 20th of January, we'll be talking about the way that COVID has amplified need in our area and how we as a community can respond with Mary Kay Wolf from United Way and other local leaders leading that conversation. On the 17th of February, we'll be talking about how we can be connected with each other during this time, and especially thinking about fellowship and faith communities during this season of COVID. In March, we anticipate talking with some of our school leaders about what we have learned during the time of COVID, about the needs of our students, especially given the online learning that we've been using. And in April, on the 21st, we will be looking at climate change in the driftless region with Casey Meehan. So we thank you for connecting with us today. We're going to invite Becky Goshi of English Lutheran Church to offer a prayer, and then we'll introduce today's topic.
Thank you, Park. Let us pray. God, during this time of surging COVID infection rates, we pray for the frontline healthcare workers who are exhausted. Keep them and their families safe and healthy. We pray for healing for those who are sick and infected. Protect those who are most vulnerable, the elderly, those suffering from chronic disease, the poor and the homeless. Comfort those who are dying and those who grieve the loss of loved ones. God, we ask that you contain the spread of the infection in our communities, our state, our nation, and the world. Thank you for our presenters today, Jen and Brenda, and their work in our community. Continue to grant your wisdom and compassion to them and to all scientists, researchers, public health officials, and governments as they continue their work with COVID-19. And finally, God, help us to be mindful of our decisions and actions. Teach us to be good neighbors to one another, willing to sacrifice for the greater good of our community. We pray this in the name of Jesus. Amen.
Amen. And thank you, Becky. So today we want to talk about COVID-19 and how it has been impacting the driftless region. And we're going to be welcoming Jen Rombalski, who is the health director for La Crosse County, as well as Brenda Rooney, who's an epidemiologist with the Office of Population Health at Gunderson Health Systems. I know that Jen and Brenda are going to be sharing data in a PowerPoint. There's a lot of information here, and so we are going to make this PowerPoint available on the Interfaith Leaders website, and I'll also be posting the link to the PowerPoint in the chat. If you have questions today, because this is a conversation, then we encourage you to get into the YouTube chat. You need to have a Gmail or Google account in order to do that, and post questions there. I'll be monitoring the chat, and later in our time together, I'll be posting your questions to our speakers today. So again, we thank you for joining, and I'll turn it over to Jen and Brenda at this point.
Yeah, thank you so much. We're really glad to be here with you today. I'm going to go ahead and bring up a PowerPoint presentation that Brenda and I have worked together to prepare for you. And I'm going to take you through aspects of this presentation, and then Brenda will come on in the latter part of the presentation with some additional information. So my job today is to really help you understand what the response has looked like from the health department's perspective Essentially, these are the objectives that I hope Brenda and I both hope to take you through today. So we want to help you understand what the health department has done, specifically in the categories of current state and use of data, key activities and partnerships, successes and challenges, and current priorities, and also to describe what COVID-19 reveals about us as a community. So to start with, I'm going to talk a little bit about the current state and use of data. So I want to recognize and let you know that this is really a point in time snapshot, these next several slides, and the data changes very frequently, including today is typically the date that we pull the data from a look back period of 7 days. And we use that data to talk with key members of our healthcare facilities, as well as stakeholders in several sectors of our communities to identify and share recommendations in relation to that data. So these slides do not reflect the data that will come out today. So this will already be, unfortunately, outdated as of this afternoon. But just recognizing it is a point in time and it does still tell an important story. So this slide will help you see, this is from the Department of Health Services website, and you can see the state of Wisconsin outlined here and the counties that are in red as critically high versus in dark blue, which is very high. So you can see we are in almost all of our counties really are in critically high categories of disease activity. Additionally, when we look at the percentage of positive tests, there's a different map that would pop up for that shows really all except Dane County are at or greater 10% of positive test results for all tests being conducted across the state. This slide shows a snapshot of the data for our county. If you go to the website at the bottom of the screen, this is the home page essentially for the COVID-19 Collaborative. This is something that is updated every day for the day prior. So for example, I pulled this data from last night, so it would have been for the 16th. And what you'll see on this slide is the average number of cases per day over a 7-day time period. The percentages of those tests that have been positive for our county. You'll see a graph relating to those average daily numbers of cases for that look back period. And then some statistics on the bottom are daily positives, daily test numbers, total active, ever tested, ever hospitalized, and total deaths, as well as new deaths. So it is a nice, helpful snapshot for you to be aware of that is available for you. Going deeper into that COVID-19 Collaborative web resource page, we can see that there are 3 primary metrics that the collaborative has been tracking. The first one is really the new case rate, and that case rate is a per 100,000 people. That's what makes it a rate as opposed to just a number or a count. This is a 7-day rolling average, and as of last Wednesday's data, our rate was 105.4. We also see the new hospitalization rate, which again is a 7-day rolling average. And we see metric 3 is something we call COVID care capacity. This is something that our healthcare systems share with us as to what they feel their capacity is on a scale of green, yellow, or red. So you can see the color coding here for these metrics. Again, a way to help you see what these metrics are doing over time. As far as hospitalizations, we have been concerned with hospitalizations, particularly in the last several weeks. This area continues to grow in concern, and it is greatly impacting our healthcare systems at this time. So this graph on the left shows you the projected trajectory of hospitalizations in our Western region. And this is for the absence of public behavior change. So this is a modeling graph that helps you see, and I see the dates cut off here, but by like early December, we might be in an even more dire situation in our healthcare facilities and our ability to care for all healthcare needs in our communities. And then the graph on the right is the number of new hospitalizations every day in the Western region. That is a 3-day running average. Our community indicators that we are routinely tracking, these three, number 4, 5, and 6, are really relating to public health. So we are charged in public health with trying to quickly connect with all cases, those that are confirmed with COVID-19, as well as those that are close contacts, which typically are the result of those case investigation interviews. So when one of our investigators speaks with a confirmed case, one of the most important questions that we ask is, who might you have been in close contact with over the last time period that you might have been infectious? And we talk through that with them. So these are metrics that help us see how we're doing with regards to connecting with cases and contacts in a timely fashion, which typically our goal is 2 days. This has been a struggle for some time because of the volume of cases and contacts that we have to connect with, but that's what these metrics are really helping you see. Additionally, metrics 7, 8, and 9 are really around testing. So our daily testing goal, we look at trying to meet a daily testing goal on average, and also how fast those tests are turning around to get results. This is actually getting worse in terms of the testing turnaround time, and the positive test ratio has been growing. We would like that to be at or less than 10%, and last week were at 31.1. So this is also on the COVID-19 Collaborative web resource site. This is the case data tab that you'll see, and you can move these slider bars in order to see the demographics of cases and some specific details about those cases for whatever time period you'd like. So you can start at whatever date, even as early as the first case that came into our county, and you can designate which time period you want to look at. So we start with demographics here. So you can see these are some of the demographics by gender, age, and race. And I was pulling for the time period of that last look back period. Again, the same look back period, looking at case details. So this will tell you about those that told us they attended gatherings, the origin being related to a close contact, community spread, or travel, as well as the severity of the disease course that any particular case had. And then this will show you the case rate by municipality and the new daily case rate for areas in our county. So then I want to move to the data use, and I want to talk a little bit about a couple of ways that we use this data. So we take this data every week to a conversation with our healthcare partners in this COVID-19 Collaborative. And we also speak with several sector representatives. So higher education, K through 12 education, business sector, and others. And we share this data and we talk about recommendations and what we want to say to the community as far as ways that we can help protect each other and decrease the spread of COVID. So these are a few highlights from last week's set of recommendations. So we use data to guide the recommendations that we provide to the community each week. We also use data to communicate accurate information. So this is just an example of a post that we put on our Facebook page for the La Crosse County Health Department. And we try to communicate across our opportunities through the website, our partners' websites and social media sites, our social media sites at the health department, and more, in order to get the right and accurate information out to our community members to make good decisions. So I do just want to highlight that from the social media angle, this has really been a success. I'll mention later as well. We've had the opportunity to develop a pretty big reach across our community with about 76,765 individuals and more than 17,971 engaged relating to some of our posts like this one that you see on the screen. That is really important to us in order to make sure we're communicating with our community residents. Before we move on to activities and partnerships, I do want to pause here and give a little bit of an overview of some of the data that's being discussed in the collaborative meeting right now. And I want to share this data. I want to preface by saying there's never any judgment when it comes to sharing data. It is just what the data is telling us about the most recent look back period. But we are seeing that among outbreaks outside of the long-term care setting, there are really three primary groupings where we're seeing outbreaks and case clusters right now. The first is in community-based exposures. And within this category, we're seeing that businesses as employers are one of the single largest outside the household transmission source in this last week's data. Predominantly, we see these outbreaks, and we understand that the greatest protection to public health and safety for these entities really comes from the continuance and adhering to isolation and quarantine guidelines. And that it really is, if you're a confirmed case, staying home and away from others for 10 days until you are fever-free for at least 24 hours and your symptoms are improving. And for close contacts, we understand it's a long time period, but the gold standard remains 14 days for quarantine. And we really ask our employers to do their very best to support their employees to adhere to those isolation and quarantine guidelines. And we know how difficult that can be for businesses, but if we are not supporting employees to do that, and we are not encouraging our businesses to follow those guidelines, then we will get additional outbreaks and spread in our community. So it is really important. Secondly, within the community-based exposure side, we're looking at, there have been at least 7 different bar exposures this past look back period. Largely that's driven by an infectious person who is at a bar, likely not wearing a mask, transmitting to staff, and then staff can then transmit while they're infectious and working. An important example, though I hate to admit it because I am a Packer fan, is in relation to a bar showing a Packer game and having a large crowd relating to that Packer game. Again, no judgment, just the data, but I think it's important that you be aware of where those clusters and outbreaks are happening. We also think that these exposures might come back and be linked to those increases in the 18 to 24-year-old age range. The third area in the community-based exposure category is churches. We've had at least 4 clusters in the last look back period relating to someone who was ill attending an in-person service. And we know that the full extent of these exposures are not likely to play out until the next week or two as we see additional spread potential from that. And just a reminder that spread can be wider when associated with activities such as unmasked singing or singing in general, or just not in generally wearing masks, which is really an important tool we have right now to decrease the spread. So that's the community-based exposures. We also have school-based exposures, and I'll just quickly mention we've had an increase in those college age individuals. We had that really kind of steady off from back in late August, early September, and now we see that increasing again. We worry about that because we then see those increases followed by additional cases in sectors such as long-term care, where those individuals might be part of the employment workforce. We've had 168 cases in the first 16 days of November in K through 12 schools as well. 13% of those cases relating to extracurricular activities, including sports. So we're watching that carefully and are concerned about our school-aged children and families. Finally, the last category is personal gatherings. And this was really what I thought I was going to be highlighting for you this week. But this last look back period was not as high in the social gathering section as it was in these other areas. It doesn't mean it isn't still a concern. It certainly is. And I feel caution and want to express that relating to the upcoming holiday, as well as hunting trips that we know are likely to occur. We did have in the most recent look back period, one celebration with 20 individuals, in which 5 ended up being a confirmed case and 3 are symptomatic and being tested. So just wanted to share some of the data that's coming out yet this afternoon relating to the most recent look back period. So moving on to activities and partnerships, I want to talk about just a couple. So first of all, the COVID-19 Collaborative that I've already mentioned, it's really such a wonderful example of how our healthcare systems and our health department partner together around health in general and trying to assure the best opportunity for health and providing recommendations to our community relating to COVID specifically. Another example is business recognition program, and we titled this Check the Spread. This business recognition program has been fairly successful. We wanted to find a way to highlight and recognize businesses that were really doing the right thing, because there are many out there that are, and we're really grateful as a community to all of the work that they're doing. So I just note here that at the present moment, there are 212 businesses that have taken the pledge on the Check the Spread website. And the key safety measures here are masks, all staff wearing masks at all times and having signage posted to strongly encourage customers to wear masks, healthy employees, so monitoring system for their employees to make sure that someone is not presenting to work while they are symptomatic, sanitation, and cooperation, so that if a staff member tests positive or becomes ill, that they pledge to work with the health department to try to support their employees and decrease the chances of an outbreak at their establishment. And I do just want to highlight that this has been a really wonderful partnership with the Weber Group, Brian Fukuda from La Crosse County, business organizations like the Chamber, Downtown Main Street, Explore La Crosse, LADCO, the Tavern League, and early adopters taking the pledge, including Gunderson and Mayo. So we're very grateful for this partnership. And then also we did work with an individual at UW La Crosse in order to try to engage the 20 to 29-year-old group. And there were a number of aspects relating to this project. And that included interviews and focus groups to learn about barriers to mask wearing in this population, which we then pushed forward into messaging and communications. We also purchased and distributed 6,000 masks on September 24th through the 26th, which we think was a very helpful project to engage that group. And then lastly, I just want to share that we have been so grateful to have the National Guard resource available. We do not have enough capacity in our community to do all of the testing that we want to. Our healthcare partners are wonderful in terms of testing, but we needed to have community testing, and the National Guard resource has been very helpful. We have a team of a few paid, but many volunteer individuals who help support these National Guard testing sites. And we have currently 4 of them occurring each week. So we're really grateful for that partnership as well. Now to just talk a little bit about some successes and challenges. So first of all, we have done some modeling, and our public health response has averted thousands of cases and contacts, millions in lost productivity and healthcare costs. So in numbers, we know that we have averted about just under 1,200 cases and about 9,000 to 11,000 close contacts that would be related to those cases, 35 hospitalizations, 6 deaths, over 6 million in lost productivity, and about 2.5 million in healthcare costs. So that is an important response, and we're really proud of that. Really, everyone who works in the health department is here to serve, and public health is a calling for them. It is not simply a job. So I wanted to share that success with you. And then also I mentioned previously the communication side. This can either make or break a response and an emergency in trying to help those that you need to communicate with understand what you're doing, why you're doing it, and how they can help. So our communications team in our health department have been working very hard, and they've done a very good job to build this sort of trusted source for accurate and reliable information. Being first, being right, and being credible is really what we strive for. And we can see it in the engagement on our social media sites. So we're really thankful that that has been successful because ultimately that means that we're able to connect and communicate with our community members. Some challenges, and of course there are many, but first of all, misinformation and disinformation. In the age of technology, we have individuals who will do internet searches and believe that information is accurate, and it may not be. It is hard for folks to understand what to believe. And so that's why we continue to try to drive them to our site for everything they might need. And we're working really hard to be credible and provide them with accurate information. Antigen testing can be very confusing in our community in terms of why we have it, what it's there for, and I'll talk more about that in a few minutes. And then tools that are only effective if we're widely using them. So unfortunately, masks have become very polarized and political, but it's very basic that masks have a lot of research behind their effectiveness in terms of being one of the best tools that we can use right now to prevent the spread of disease. Also, behavior change. Many of us know if we've ever tried to make a constant and persevering behavior change, it is not an easy task. And when we ask individuals in our community to make a behavior change and to keep that going for months and months, it's a big lift. It's a big lift for an individual. It's a big lift for a family, for a community, for organizations and groups. So we recognize that, and that can be challenging. And then policy changes, especially when they've been legally challenged, can shake up where the authority lies and make it really difficult to set good policy in order to support the decreased spread of COVID and other diseases. So talk next about some current priorities. First of all, we have 6 main focus areas to our response. They include data, testing, vaccination, disease control, communications, and something we call congregate settings. And ultimately that is really our business team and our liaisons to daycares and schools. They are very specific types of entities that we try to support and help walk through when they have an outbreak or cases so that they know what to do. And we just try to support them through that process. We do have a program plan for COVID response. Our ultimate goal is very simple. We want to identify disease and limit spread. And we have 4 main objectives. The first is to describe or distribute factually accurate information. The second is to establish strategic partnerships and agreements to assure adequate testing and vaccination, as that is coming very shortly. Number 3 is to analyze and disseminate data to inform decisions in collaboration with our partners in the community. And number 4 is to connect with cases and contacts in a timely fashion to assure appropriate isolation and quarantine. So on the disease control side, I just want to share some disease control basics. First of all, this virus likes to spread from person to person, particularly when someone is in close contact to someone else, which is why we define a close contact as someone who's been within 6 feet of a confirmed case for at least 15 minutes cumulatively over a 24-hour period. So that's how we define a close contact. Also, our current tools to prevent spread really are masking, everyone wearing a mask when they go outside of their household, or face coverings. Physical distancing is really critical, that 6-foot rule. And again, that's because the virus likes to spread when individuals are in close contact with one another. Hand hygiene, so washing hands frequently or using sanitizer, recognizing that surfaces can be contaminated. And then finally, isolation and quarantine. Just want to clarify, isolation means it is for someone who is ill or is a COVID case. Quarantine is for someone who has been in close contact and is at the potential for developing COVID and therefore needs to be in quarantine, because we know that you can be spreading COVID up to 2 days prior to symptom onset. We also know that many do not experience symptoms, or they're very mild, and that makes it difficult for us to quickly identify that someone might be spreading COVID-19. On the testing side then, want to just talk a little bit about the types of tests and testing sites. I'm going to show you 3 slides here that go over the 3 main types of tests. I'm not going to dive into these in detail, but know that this will be available for you as a resource. These are also posted on our Facebook page for La Crosse County Health Department. But this slide goes over the PCR, or the molecular test. This is the gold standard test that really does diagnose someone with COVID-19. There's some pros and cons, and also a what your results mean section of this slide. The next one is the antigen test. Again, similar formatting here. And what does the results mean to help individuals who might be seeking antigen testing? So sometimes these can be more quick in terms of the results, but they may not be as accurate. And in the state of Wisconsin, it's important to note that if someone is symptomatic and gets a positive antigen test result, they are considered probable in our communicable disease system. And we do not follow up on probable cases, only on confirmed. And there's a number of reasons for that, but that can be very confusing to folks. And if someone is antigen positive test result and is not symptomatic, all of those, a positive antigen, we would recommend a confirmatory PCR test to make sure that those results are accurate. And lastly, there's an antibody test as well, and these are available in our community too. And this goes over pros and cons of the antibody test. And then community testing in La Crosse County in particular, we have tests that occur on Monday, Tuesday, Friday, and Saturday. What I've listed here is the upcoming testing locations and the website for what you should use as the best place to find the most up-to-date information on testing available in the community. A note too that the National Guard I mentioned is a really helpful resource. That Guard deployment is technically ending on December 10th. The state currently is working on and has applied to continue the National Guard deployment, but that has not yet been confirmed. So we are hoping that it will continue, because we think it's a really important resource for our community to have access to testing. Then I'll just talk a little bit about vaccination. Vaccines, we have about 4 of them that we're aware of right now that are in phase 3 clinical trials. We don't know exactly when the vaccine will begin to come to communities such as ours. It could be an aggressive time frame, might be as early as mid-December. So we are planning for this already, but it could be later than that as well. So there is the Moderna and the Pfizer vaccine. You might have heard recently about the Pfizer vaccine, and the effectiveness of that vaccine is looking really good, as is the Johnson & Johnson. Just recognize that the first 2 on this list are a 2-dose vaccine series given 21 or 28 days apart, and they require being shipped and stored at very cold temperatures. So this means that many health departments, many aspects of our community that would normally give vaccine do not have these types of equipment pieces to store vaccine at these temps. And then we have to give them quickly once they reach us. They have to be given within 5 to 7 days, depending upon your storage and handling abilities. This Pfizer vaccine also at the present moment ships in a really large package. So 975 doses is the smallest package shipment of this vaccine, and that could be difficult for us to make sure we can get distributed appropriately. The Johnson & Johnson vaccine, we've also recently heard about, as I mentioned, with a good effectiveness rate. It's looking good so far. That is a 1-dose vaccine, and both of these last 2 on the list ship and store at refrigerator temps as opposed to the very deep cold temperatures of the other 2. Just to note, there are 3 phases, and the first phase in which vaccines will come, we expect this to be a short period of time, and doses are likely to be very limited early on. So the state actually has an ethics committee that's working right now on all of these questions relating to who gets it first, who gets it if there's not enough vaccine for that first group even. But in general, we're looking at healthcare and direct exposure individuals, essential workers, and those that are at high risk, including those that are 65 and older. So this is my last content slide, and really what I'm showing in this slide is to say, what can you do to help? And there's really 3 main points I want to make here. And one of them is to follow the recommendations. If everyone in our community can make this lift, we know it's difficult to do some of these things, but if we can all do that, it is us seeing ourselves as individuals and our families as part of a broader community, and the fact that we can help each other fight against this virus. Secondly is sharing accurate information. So make sure you're getting information from quality resources, and I share a few top ones here. And lastly, stay connected. So you can sign up and connect with us on our Facebook page, Instagram, YouTube. We have materials in Hmong and other languages as well. And we also have an electronic newsletter. If you go to our homepage of our website, it's right at the top of the homepage that you can sign up for the newsletter. And now I'm gonna kind of kick it over to Brenda, and I'm gonna close with this final slide before Brenda moves on. And basically, I just want to say, remember that what we're fighting against here is a common enemy that is not each other. It is a virus. And I think when we come together as a community, we have a chance to win this fight. And I just want to say that as the health department has been doing some strategic planning in addition to COVID response, we've seen that we recognize the social determinants of health aspects. So housing and economy and those in our community that might have less than others, that we're going to see those inequities really rise up and become challenges in the future. And I think that sort of just puts us right into what Brenda's going to talk about next. So I'll go to you, Brenda.
Well, thank you, Jen. That was a great segue into my presentation. I feel like COVID is like a wildfire. It's just kind of rushing through our community. And what happens when the wildfire is over will be, I think, the time for us to really come together as a community to figure out how to replant and reflourish. So if you go to the next slide, please. This is from the Wisconsin data on disparities in COVID, and there's a lot of really good data out, as Jen has mentioned, at the DHS website. And the first sentence of this slide really is what caught my eye, which is really highlights that the world is really one very large organism. And the pandemic has really reinforced the fact that every person's health is intertwined with the health of others in their community. So just like Jen said, we have to fight this battle together and not against each other. Unfortunately, we're seeing that not everybody's risk is the same. And we've seen some huge disparities among the Black, Brown, Indigenous communities of color, as well as in our impoverished community. So next slide. Next slide. So this is from early. This is April 16th. And this looked at deaths by state, and it looked at deaths for African-American population. And Wisconsin was one of the widest racial disparities of all the states in the United States. So nearly 40% of deaths in our COVID patients by April 16th were among Black people, but less than 10% of Wisconsin people are Black. So you can see just this huge disparity, and that was as of April. Next slide. This shows that if you're Black, Latino, or Indigenous, you're 3 times more likely to have died from COVID than white Americans. This was through October 13th. 3 times more likely to die. Next slide. And this is a slide that shows the rate of death per 100,000 in Wisconsin over time. So this tracks back to June of this year through October 13th. And you can see that that rate is just climbing, continually climbing. Next slide. If you go to the state website, this data is available and you can look at the cases, hospitalizations, and deaths by race and ethnicity. And this shows that this is data through last Tuesday, shows that if you're Hispanic, you're 2 times more likely than a white patient or a white person in Wisconsin to have developed COVID. So 13% of the cases are from Hispanic or Latinx population, but only 7% of our population is Hispanic or Latinx. And the cases per 100,000 is twice that of a white person in Wisconsin. The next slide shows hospitalizations. And here we see that our Black population is 2.5 times more likely to be hospitalized than a white patient. And then the next slide shows that a Black person is 2 times more likely to have died from COVID than a white person. And this was as of last Tuesday. The next slide shows these are the actual deaths by date of death and race and ethnicity. And it just shows that it isn't a consistent, and that early on we saw a lot of Black Americans dying in Wisconsin. And the more recent trend is for the American Indian population, the indigenous population. So it's not a consistent trend over time. So next slide. So we know that where a person lives can determine how long they live. The social determinants of health is something that we talk about a lot, and this is kind of where I've been spending a lot of my time in the past year or so. So next slide shows 3 communities, and this is pre-COVID. It shows the length of life is really dependent upon where you live, and that very short distances within a city can affect your length of life. So Minneapolis, Chicago, and New Orleans, you can see the difference in length of life just based on where you live, based on where you were born. And those social determinants are more important sometimes than the healthcare. So one thing, next slide, that COVID has revealed is that when people have limited resources, healthcare isn't their primary focus. Their primary focus is really, do they have food? Do they have a house over their head and transportation to get to their job? Do they have a job? And with COVID, we found that a lot of people didn't have jobs. So the next slide shows that this is through May, Black and Latino and lower income renters were more likely to miss their rent in May than white or higher income renters. So we know that Black and Latino were much higher at not making the rent for May. And then the next slide shows it by income. So lowest income were most likely to not pay their May rent, and also most likely to not be able to think that they were not going to be able to pay their rent for June. And what that means is, for a lot of these folks, could mean evictions, could mean hunger, could mean a lot of things. Next slide. People who are in essential jobs are more likely to live in high density housing, are more likely to contract the disease because they have closer contact with other people, and they have less access to quality health care. And they also happen to be more disproportionately African-American or Latinx population. Next slide. The other thing that we've seen is that this has disproportionately affected women, and particularly Black women, with over 850,000 women leaving the workforce in September alone. And the sentence, the last sentence in the first paragraph, it's going to potentially take decades to generations for us to potentially bounce back from some of these inequalities. And the main reason for women being disproportionately affected is because a lot of women are in hospitality and healthcare and government positions that where there have been more layoffs. School closures and lack of childcare tends to affect women more, and women have fewer opportunities to work remotely, as do low income and more racial or Black or Latinx Americans. Next slide, please. So women of color are reporting higher levels of food insecurity. If you don't have a job and you are worried about your rent, you're also more likely to be food insecure. And women have lost employment at least twice as likely to report not having food to eat. It could take decades to fix these inequalities that have been created because of COVID. But I think the silver lining, because I think we all have to look for silver linings, is that we've known about some of these inequalities for many, many years, but because COVID has hit so hard this population, it's been much easier for us to see it and to talk about it, and for people to see that it actually does exist. I have to believe that we are very lucky to live where we live. This slide just reminds me that we live in a beautiful area. We're blessed to live here. And we are going to get through this, and there will be a silver lining to this. There will be a rainbow. And I think that the community will rise up and take ownership and partner together to fix some of these issues. It sounds like the next community conversation will address some of these issues. So I'm glad to see that that's kind of the topic for the next several sessions. So I think that's all I had to share.
All right, thank you. That's a lot of information, but I think we're all drinking from the fire hose right now when it comes to understanding what's going on in the community and the changing understanding that we have from science and other things. So we do have some questions that have come up. I'll ask these generally, and whichever of you would like to jump in and answer can. We've got 10 to 15 minutes left for the conversation, so probably good to keep the answers shorter, and then we can elaborate if we need to. First of all, Kathy and John were wondering, can you share some of the hotspots, or is that information available somewhere for people that want to know what locations are proving problematic?
Yeah, so I can share that on our COVID-19 Collaborative website. Again, that site location is on the slide set. You can find case data by municipality. So for La Crosse County, that is the best location to go. That will provide up-to-date information, again, for whatever time period you would like to look at. Additionally, if you are looking for statewide information by county in the state, the Department of Health Services site is another option.
Okay, thanks. I know you guys have been getting lots and lots of feedback from all sides and fronts on this. One of the questions that we have is, what are the top 2 excuses for not masking that you've heard?
Yeah, we hear from folks that well, first of all, some don't want to talk about it, and secondly, that folks don't believe that it is actually beneficial. They don't understand that there are many studies out there that support the use of masks, especially when layered with other tools to prevent the spread of disease, specifically COVID. So I think some don't understand that actual science behind it, and some have a variety of other reasons. It's not comfortable, it's an inconvenience, or they just don't believe in it.
Okay, thanks. DGW asked, how can we engage people in our community, our businesses and nonprofits and others to try to start moving some of those metrics that we've seen in the positive direction. And I think those metrics were the ones you shared early in the conversation that are available on the COVID website that are red, green, yellow, that kind of thing.
Yeah, that engagement question is a tough one. We've been working for months and months. As you can see, we tried doing business recognition program. Earlier on, we were able to do some of those, what I would call sort of primary prevention opportunities, that business recognition program, engaging the 20 to 29-year-old age group when we understood that they were going to be a significant part of the disease activity at certain points in this pandemic. Some of those have been fruitful, and we've really tried to get creative with communications. If you haven't followed our Facebook page, one of the most popular communications that we posted was the individual on the Don't Spill the Chili from The Office. So doing just some creative ideas to get the attention in a different way, trying to instill some humor where it's appropriate to do so. But honestly, if anyone listening has any ideas for how to engage more in our community, we would be so glad to hear them. We are at a point where we're not sure what else we could say or do to help individuals and families and businesses understand that the spread and continued spread of COVID is not good for our community, not just from the disease side, but also for the long-term economy and other aspects of our community. So we'd love to hear any ideas you have.
Great. Mary Kay asks if there are practical physical ways for bars, small restaurants, and others to stay open and safe during all of this, especially as we're moving into the winter period and the outside dining is going to be harder and harder.
Yeah, I have a few ideas for that one. So first of all, we've tried to really have a good partnership with our Tavern League, and I think we do. I understand, though, that these entities are all trying to keep their businesses going. Some in our community have decided voluntarily to close for a couple of weeks during this really high peak of activity. We would ask, to maintain the requirement or the health advisory relating to 25% capacity. When you're indoors in enclosed spaces, that is one of the ways we know that can help decrease the spread of COVID. So that's one idea. The other is really everyone masking, asking customers to mask. I understand that you enter those establishments to do eating and drinking activities, but every moment between bites or the drink that you should have the mask on, and that protects, again, everyone else in that establishment. And lastly, if you don't have to go, stay home. And if those entities can have drive-by services or takeout services, that is another way for us to support those establishments without actually being in the establishment and potentially spreading disease.
Sure, thank you. You mentioned social media earlier, and I was just remembering that early on, one of the videos that I saw on Facebook was by some guy who called himself Uncle Rob, testing surgical masks using propane gas and foam-headed dummies. And it's very funny, and it's also surprising just how effective the masks were at preventing things from spreading.
Yeah, another one that's been fairly popular is Charlie Barron's. So he's done some good ones for us. He kind of plays on that Packers versus other teams, and that there can be good, healthy rivalries. So yep, there's a few good ones that help get the attention in a new way. Yep.
Okay, so Jennifer asks if we are really anticipating seeing significant changes with the incoming administration at the federal level, whether we might expect a federal mask mandate or any kind of shutdown. What do we know about that right now?
Yeah, I think that will play out more in the next several weeks and month or so. We're learning about what that administration may have. But what I can say, and again, this is not political in any way, shape, or form, but the current response has really made for the Centers for Disease Control, the CDC, to not be in the role that we normally see them in disease control and sharing research and information. So we would certainly hope that whatever that response is, that has a strategy and a plan associated with it, which will allow states and counties to support something that is consistent across states as much as possible, as well as the CDC really being there to be the backbone of the science and research for the response going forward.
Right. One of the challenges in the public realm is that government is always a balance between the individual rights of citizens and the collective good of all. And America is always working out that balance. And sometimes we have to see it shift. I know, like during World War II and the Depression, we saw it shift more toward we gave up some of our rights and privileges in order to serve the collective good. And typically that's how we respond to public health emergencies too.
Yeah, I'm glad you bring that up. We recognize that is, those are ethical conversations, and it comes back to our culture and what we value here. And, there's neither is right or wrong in general, but when you're trying to decrease the spread of a disease and it's not something that is known to really help you get to herd immunity if a certain number actually get the disease, because of the way COVID is and how it spreads. Until we have the vaccine, and even that is not a sure tactic, if we don't have good volumes of individuals getting the vaccination, we have a set of tools, and until we can maximize the use of those set of tools, we aren't going to see the decrease of spread that we really want to and need to see in order to have a healthy economy and healthy people living in our communities. And that really is going to require a full lift, and a set of individuals or a set of families or one community out of many is not going to get the job done.
I think also there needs to be some consistency in policy across states. And so a national policy might be good for some things, but yet you still need some local control, because not every community is the same. And like I know early on in the pandemic, we were seeing very little, very few cases in small communities, and in large cities, a lot of cases. And so the same policy for both didn't really make sense. So there does seem to need to be some regional or local policies, but know that the virus doesn't know when they drive across a county border or a city border. So.
Right. Thank you, Brenda. One of the points of these conversations is also to think about this theologically. And I know that most faith traditions, and certainly the Christian tradition that I'm part of, place a strong value on loving others and serving others. For Christians, we often look at verses like Matthew 20, 27, 28, where Jesus says that if you want to be the greatest, you should really be the least and serve others, just like he came to serve others. And in John's gospel, Jesus says that, the way you love me is loving other people. And that's how everyone's going to know you're my disciples. And I think a pandemic is an excellent opportunity for those of us whose faith leads us to believe that we really should place the care of others above our own self-interest. That's a good opportunity for us to live out those values. We are just about at the end of our conversation. I don't know if either of you have any final comments you'd like to share.
I just want to thank you for the opportunity to be on. I think, if I could send a message to our whole community, it really is that we are in this together. I know some, struggle with trusting government. Some struggle with the value of the mask. But again, it really is, there's a simple set of tools We're all here to help. We have to think about our whole community. Many are already doing that. We just need the majority and the whole to really be there. And we will see decreases in spread of this disease.
I've just been very overwhelmed by the creativity of people in solving solutions and, really finding solutions to things. And I'm just overwhelmed with the heroic efforts of folks at the health department and at the health systems and at the long-term care facilities and schools. Just lots of heroes around us every day.
Indeed. And I know in our congregation, we pray weekly for everyone who's involved in this, for our public health officials, those in the hospitals and nursing homes, those that are doing the research. We're just so grateful for all the work that you guys are doing. And again, while it will be helpful perhaps to have some high-level guidance, in the end, it comes down to what do we need in our local community. And the COVID Collaborative has been excellent in providing some of those resources for us. So thank you very much. And I'm going to give you a virtual round of applause here. For those who are watching online, thank you for joining us. And just a reminder that this will be archived on the YouTube channel for English Lutheran Church and also available from the website for the Interfaith Leaders Coalition. And we hope that you can join us on the 20th, when we'll be talking about how COVID is kind of exposing or exacerbating some of the underlying issues that we see in our community in terms of poverty and homelessness, economic disparities, things like that. And we'll have a panel of speakers for that. It should be an excellent program. So we'll see you again and have happy holidays, whatever holidays you might be celebrating. Blessings.